Today on Diabetes Connections Type 2, like a lot of people diagnosed with diabetes, Matthew Tremellen didn't feel like he got enough information fast enough from his healthcare team. So he decided to build a tool to help. We're talking to Matthew about DiabeticU, a new platform that aims to make learning about and managing type 2 easier. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Hello and welcome to Diabetes Connections Type 2. I am always so glad to have you here. I am your host, Stacey Sims, and I have a bit of news. This is going to be our last episode of Diabetes Connections Type 2. I launched this podcast in the fall of 2023, and I have been thrilled by the response. You all have been amazing, and I stand by the need for an easy-to-understand, educational, and patient-focused podcast about type 2 diabetes. I'm going to leave the show up for the foreseeable future, so you'll be able to listen to all of the episodes, and you can still refer friends here. There are more than 50 episodes. They will be on every podcast app and over at diabetes-connections.com. I would urge you to please follow or subscribe to the original Diabetes Connections show. We focus on stories and news for people who use insulin. It's not just about type 1 diabetes. Especially our In the News episodes focus on all types of diabetes. We've been doing Diabetes Connections for 10 years now, so I hope you join us over there. Ending this show on this episode with DiabeticU makes a lot of sense to me. It's a summary of all the gaps in care and education and how patient advocates are trying to figure out how to turn this around. Yes, this is a business, but as you'll hear, this is something that the founders want to make widely available and at as little cost as possible to the person using it. It's hoped that insurance or employers will pay in the long run. DiabeticU currently supports people with type 2 and prediabetes with a range of personalized meal plans, exercise routines, blood sugar monitoring, and more. The founder, Matthew Tremellen, was diagnosed with type 1 in his late 40s. He'll tell his story, but as I've said, he just didn't feel like he got enough information. Here's my conversation with Matt Tremellen. Matthew, welcome to Diabetes Connections Type 2. I am so interested to learn more about this. Appreciate you spending some time with me and my listeners today. Thanks.
I appreciate being here, Stacey. I'm really looking forward to it.
What is DiabeticU? Can you kind of explain what this is all about?
Yeah, so DiabeticU is a platform that gives users the ability to manage everything with their diabetes in one place. So we're currently for type 2 and prediabetes, but we give them everything they need in one place. So we do personalized meal and exercise plans. We do education based on where they're at in their journey and their health literacy. And we also connect, we're a Dexcom Health Apps partner. So we connect with all of the different devices, including CGMs, fitness wearables, digital weight scales, and we're getting ready to add sleep data and stress data as well to give them a comprehensive overview of how everything they're doing is impacting them both positively and negatively.
So where did this come from? We've talked a lot on this show about how there's not enough endocrinologists, right? There's just not enough information. Is that need you're trying to fill?
Absolutely. And I think that going through the journey myself, being a person with type 2 diabetes, I really saw the gaps in care, the gaps in education, and the gaps in resources. And that's kind of funny to say because there's so much out there, so many resources, so much education, but they're just not shown to you. They're not provided to you unless you actually go out and really research it yourself. So, the goal for us was to really create that platform, one that gives a user the ability to self-manage, because that's one of the most important parts. 99% of the time, you're managing it on your own, but then also tying in a telehealth component, giving them the ability to meet with certified diabetes educators and registered dietitian nutritionists so that those care providers are able to utilize that data to create hyper-personalized care plans for them and really meet the user where they're at and bring them along on the journey for better health.
All right, I have a dumb question. The word platform gets thrown around a lot. What does that mean? Is it an app? Is it a website? How does the person use it? Like, what does it look like to me, the patient?
I love that question because we were redirected to use the word platform by people within our organization. And I think the reason that was, and to answer the question on that, is the first component of it is the application, right? The application for the phone that the end user is able to really use to manage and connect to all those, different aspects. But the reason that we use platform is because it is not just the app. we'll be branching into the telehealth services to involve the care providers with the certified diabetes educators and the registered dietitian nutritionist. And then our long-term goal is actually integrating within the EMR EHR systems so that we give what we're called DiabeticU total care, which is they're involved, not only is it the RDNs and the CDs, it's also involving your primary care provider and your endocrinologist. So everybody's working on the same data and the same information to create that personalized care.
I'm pretty good with doctor language, but EMR, what is that? Is that the doctor office interface?
Electronic medical records and electronic health records. They call it. It's funny because technically it's the same thing, but they say EMR, EHR. I'm the same. I'm not the best on the lingo all the time.
Perfect. I appreciate that. Yeah, we like to translate around here when we can. But that makes a lot of sense because when you say platform, we as the patient would see one thing, your doctor's office, healthcare providers would have a different part of the platform. It's comprehensive.
Absolutely.
Okay. So take me through some of that because, as you said, it's very personalized. When you're talking about meal plans, how would somebody come up with information like that? Are you meeting with folks? Are there questionnaires on the app? All of the above?
So we take them through an onboarding experience through the application to understand where they're at in their health journey. And we take, of course, all of the different biomarkers and look at like their age, their sex, their height, their weight, all those different things, what type of diabetes they have. And of course, we utilize the clinical formulations that would get them to what their meal plan would look like. I think that one of the great things about our meal planning services is they're actually ever evolving. Right. So they are always taking into consideration your weight and all those other factors as you continue on your health journey. We actually are even going to be implementing their glucose levels into that over time as well. So we can really hyper personalize that meal plan to them. But for example, it connects to a digital weight scale. And part of how you come up with that calorie count has a part of being the weight as well and part of your activity. So as their weight is changing, going down or going up, whatever the case. And as their activity changes, because they're connected to their physical devices, those meal plans will actually change and morph along with it as well.
Okay. I have a pause there because when you say there's a digital scale that is linked into the app, like the icy dread, right, that went through my body of somebody seeing the weight. And I know how important that is. But you must get a similar reaction from people who use the app. It's scary to share that kind of information. How do you reassure people that their information is protected and I don't want to say their ego is protected, but there's a concern there, right? That people are just worried about that kind of information.
Oh, absolutely. Of course, with all the stigmas around it as well, there's two parts of it. The first part is our whole mission and goal at DiabeticU is to be a support system for people that are living with diabetes, and we're 100% a judgment-free zone. But the most important part about that is that we're not sharing that data with anybody. The only people that have the ability to share that data is the actual patient, is the actual user themselves. And we're giving them the ability to pick and choose what data they share as well. So we're going to get a little bit more sophisticated with data sharing with their providers. If they want to share their weight data, if they want to share their fitness data, things like that, they'll have the ability to say whether or not they do want to share that. Of course, we always encourage the sharing because it is very helpful for the type of care that they're getting. Those extra data points really, truly help the personalization aspect of it. But at the end of the day, it's your journey and your information to share the way you see fit.
You've mentioned CGM a couple of times, which is such a game changer when it comes to diabetes. Talk to me a little bit about that, including some of the partnership you've got with Dexcom.
Yeah, that was paramount for us. I guess I'd take it back a couple of years. One of the big reasons that I even got involved and did this company was because I was very much struggling with my diabetes management. The first 2 years of having type 2, I was horrendous for me. I went on the sideline of eating way too healthy to where it was unhealthy. Just, no carbs, no sugar, nothing. My A1C was phenomenal, but my health was horrendous. And this was all just me personally experimenting, and then I went back to eating carbs and my A1C shot back up and my glucose levels were kind of not where they should have been because I just didn't understand what I was supposed to do and how I was supposed to eat. I got really lucky with the company I was working with at the time because they sent me an actual or the insurance company that they were with sent me an email, just a random email, and I just happened to be checking my spam because it was in my spam. And they said, hey, if I think it was United Healthcare at the time. If you want a Dexcom CGM, we will supply that for you at no cost. Because you have type 2 diabetes, it's a new program that we had. I didn't even know what a CGM was, to be fair. And I was like, sure, sign me up. Sounds great. And getting that data, once you actually put it on, and for those at home that don't know what a CGM is, because a lot of people don't, it's a continuous glucose monitor. It is taking away you pricking your finger with a blood meter, a glucose meter, and you wear the device and it checks it every 5 minutes. And that is a life changer. It's a game changer in itself, because seeing how food impacts you, seeing how stress impacts you, seeing how your exercise impacts you really opens up your eyes in a lot of ways that you would never understand. So for us, that was paramount to be able to create those partnerships. The partnership came, just perseverance. I really was, I knew that was something that we really wanted to have within our platform. And I just really kept putting the pressure on and reaching out and seeing which ways we could go to connect that data. We ended up, creating that partnership and ended up becoming a Dexcom Health Apps partner, which was humongous for us as a smaller organization that's starting out.
Yeah, that's great. Before we go on, tell me about your diagnosis, because we just met Matthew, but you seem like you're on the younger side for a type 2 diagnosis. If it was a couple of years ago, as you say, as well, how'd you find out you had type 2?
By chance. I'll tell a story. It's probably embarrassing to tell a story, but it's pretty funny. I was in a leadership position at an organization, and we're a very fun organization. So we played ping pong a lot at the office. And when I say a lot, I used to battle all of the people that worked for me. We used to have these, fun little battles. So we played, maybe an hour and a half a day, sometimes after work. And I was losing a lot of weight. And to me, it didn't really make a lot of sense, because I was eating healthy for a while, but then I stopped, and it wasn't like I was eating bad, but I just wasn't eating to where you would lose weight. And I was in healthcare, so I knew a lot of doctors, and I was talking to one of my primary care doctors. He was like, "Oh, well, what have you been doing differently?" And I was like, "Well, playing ping pong." And he was like, "Oh, well, that might be it. I mean, if you're playing an hour a day, you're actually working out. I mean, that could be the reason you're losing weight." But it kept being consistent. It was like 3-4 pounds a week. So it didn't make sense to me. So I called my mother. My mother has been a RN for 40, 50 years, forever. And, I called her and I was just like, told her what was going on. And then she just started asking the diabetes related questions, all the symptom related questions. And I was like, yes, 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 yes. So apparently it wasn't ping pong. So my mom was like, hey, come over tomorrow morning. Don't eat anything. Just come over and we'll test your glucose levels. And my glucose levels in the morning were about 290, 300. So she was like, yeah, you need to go to the doctor and, definitely check for diabetes. So that was how I found out. I was, I think 46 at the time. So I'm 51 now. So I just aged myself, but
a very young man.
I appreciate it.
I'm older than you. Very
my
young.
son and my daughter would not say that.
Yeah, mine either. But it's funny, because you're lucky you had your mom, right?
Absolutely.
Because where do you go for that information once you're diagnosed? You've even mentioned, like, you thought you had to eliminate carbs entirely, and then you went backwards, not quite sure where to go from there. Getting back to those CGM questions, I wore one recently. I don't have any kind of diabetes. I wore the Dexcom Stelo, which is the non-prescription, over the counter, meant for people who don't dose insulin. And I've been around diabetes for so long that I can't say it was eye-opening. I knew when I ate heavy carbs or sugar that my blood sugar would go up, but I don't have diabetes. My blood sugar never went high for very long, and it always came back down. But those devices are so helpful when you live with type 1. You mentioned sleep, and I know Dexcom recently has a partnership with Aura, the sleep ring. Is that something that you're working on, or is this a different aspect of that?
Oh, no, we're actually going to bring in that data as well into our platform from Aura, as well as the Samsung rings, and Apple Health has their own sleep components as well.
Talk to me a little bit more about that, because I feel like, I'm the dummy who realized like a couple of months ago that there's a pedometer on my iPhone. I don't use any of these things, but it looks like there's so much out there that you're able to pull in from. Is that the kind of stuff you're talking about?
Oh, absolutely. And I think that's a great thing about the technology and where we're at today. that there is the ability to pull so much data related to your health and bring it into one place. That's incredible, because even when I first started the journey, I mean, I did have the CGM, but I did not have any type of other devices that could put it all together and show me that in one area. And it really does help. And it's funny because one of the things that you really start to see is, just for perfect example, is I'm wearing my Samsung watch. So I go for a walk. We have it set now to where as it auto calculates. And I'm sure you've done this. If you have an Apple Watch or something like that, you start walking after 10 minutes, it recognizes that you're walking and it'll say, "Hey, are you doing a walk?" And you just tap the button and it's, it continues to record it. Well, we have it actually set to whereas if that happens, it'll actually pull that data and bring it into your glucose graph within our platform. So you're able to see like, okay, well, I ate a meal at 12:30 and then I went for a walk and my glucose was going up at 12, 1 o'clock, 1:15, maybe it was going up 30 points. And then I saw that I did a walk right after that. And I can see those levels playing off and go back down because of that walk. So you can really see those cause and effects. And that type of information is invaluable, especially when you're going through those struggles like I was back in the day, where it was like, okay, well, what do I eat? And how does this all affect my glucose levels? Well, when you can see it happening in real time, that makes such a big impact on yourself. And you can really start to play with what you're doing yourself. Because I think one of the things that people notice is that everybody's different, right? So if you ate an apple and you had type 2 and I ate an apple and I had type 2, it might do two different things, right? Might, spike you and not spike me, or vice versa. And you have to learn those things through technically trial and error throughout the process. But having that CGM really helps that trial and error.
Yeah, exactly. You don't have to do a finger stick every 5 minutes to figure out what's going on. We used to do 10 a day with my son. It was unbelievable when he was little. Crazy.
Oh, I couldn't imagine that.
I know. The name is DiabeticU, and it sounds like you've got so many tools there. Are there educational tools, blogs, things like that, entries that people can just kind of read? I mean, everybody learns differently, but are there resources there just to go through?
Absolutely. So that's a big component for us. And we decided to actually put two different forms of education resources within our platform because we know everybody learns different. And one of the things, we've done a lot of researches on learning and education. And, one of the things that you see is that through most of your studies, people watch videos maybe 45 seconds to a minute max, right? After 45 seconds to a minute, the fall off rate is tremendous. So what we did is we have an area at the top called bite-sized lessons. And those bite-sized lessons all are 45-second to a minute videos that are aligned with your health journey. One of the things we're actually working on is algorithms that will really fine-tune what videos you see based on when you were diagnosed, or how, where you're at on your health journey, how you're doing, what your health literacy is. So it'll change the videos based on where you're at to keep educating you over time in just small bite-sized lessons. Now, of course, we know that some people are studious and really want to learn and read. So we also have another place we call the Education Station, which is for article-based information, all of the same topics, but in longer form, more content, more in depth. So the people that want to educate themselves deeper can.
That's great. All right. I've been saving this for a while. I got to ask you, what's the cost? And does the patient always pick this up, or is this a business component? I mean, you mentioned like United Healthcare covered the cost of the CGM. Can you take us a little bit through the cost of this?
Yeah, absolutely. So we have been mulling over that for about a year. And, with that, the last thing you ever want to do is add an extra cost on somebody and through their healthcare journey. But in a lot of ways, it's almost inevitable. So what we're trying, and our main goal is for this to be covered by insurances, covered by, self-insured businesses. We're also looking to partner with your concierge medicine and places like that, so that it's a value add to there and that they can offer those services either covered or for a smaller portion of a fee. We also do have a subscription-based service. And there's one of the reasons I really wanted to do that, because when I was in my own journey, I think one of the things that bothered me the most is when I was researching platforms and different technologies for me to utilize, that I saw some that might actually be useful. But the fact that I wasn't working at the right company or I didn't have the right insurance plan, I didn't even have access to them. I would have paid for them, right? For a 15, 20 bucks, 30 bucks a month. I mean, it's what health apps cost. It's what a fitness app costs. I could pay that for my health. I just didn't even have the ability to do so. So one of my goals from day one of this organization was that we always want to be forward facing in some way, shape, or form, so that if somebody wants access to it but doesn't have the ability to get it covered, they still have the ability to do so. With that, we are at a price of $29.99 a month, but we are doing an introductory offer that's actually blowing it out of the water. I think for the first couple months, it's going to be 99 cents.
Ooh, when does that expire?
We are looking at that now. I mean, our overall goal, of course, in the beginning is we want to get people on the platform, right? Because there's a couple portions of that are important to us, right? One, we want to get that in front of people, but more importantly, we want to really fine tune the platform, and that's our users are going to define that journey. So that's our goal, is to get your everyday user on it and find out, what's sticking with them, what's helping them, what features may not be helpful or could be better, and really iterating that product so it creates an opportunity for us to get a platform in front of people that is really valuable and makes a difference on their health.
Before I let you go, did I miss any of the features you want to make sure people know about?
Oh, there's two features that we're actually really proud of, and they're actually stemmed out of the same feature. We actually created a artificial intelligent virtual assistant that is helpful in a lot of ways. My two favorite parts of it is that it does what we call smart eating assistance. So if, where you're at a confusion point, maybe you're not following your plan, which most people aren't going to do 100% of the time. In fact, I probably follow mine 50% of the time. I have kids. Just happens. So when we're out, maybe after a baseball game and we're going to Outback or Chili's or something like that, I'm actually able to go into the app, and, our app virtual assistant is called DiabeticU. So he said, DiabeticU, I'm at Chili's, and what can I eat that'll lessen the impact on my blood sugar? And it'll actually, tell you what to eat or options or how to eat at Chili's. So that's one of our favorite parts. And then you can ask diabetes related questions. So if you wanted to know about the glycemic index and what foods are lower on the glycemic index, or, what's the difference between complex and simple carbs, things like that, you can ask those questions and the app will actually answer it for you right on the spot. And the last part of that feature is it just gives you the ability to easily log medication, food, or exercise. So you can literally just say, hey, I just did a 15-minute walk. Can you please log that at 1 p.m.? And it'll log that right into the application. So it's taking away some of the stress points of having to log and write down what you did or look it up and things like that. I think of the additional feature that we'll expand upon as we grow.
I'm curious, where does the AI pull the information from?
So it's all ADA data.
Oh, great.
Yes. So we pull that from all ADA data. So we're making sure that, everything, we have a lot of guardrails in place. And of course, I think that's as soon as AI is mentioned, I think that's the first thing that people want to know. And of course, you have to be responsible as an organization to make sure that you are handling AI in the most responsible way possible. For us, we put in so many guardrails that there's a lot of questions that you can't even ask. Like anything medically related, you're asking to change, how often should I take my medication, or any question that is even remotely medical, it will defer and let you know, this is something that I can't answer. You should see your doctor or care provider for this.
Great. What's the big dream here? Wave magic wand, 10 years. What you got?
Wave magic wand, we have less users because everybody is doing so well that they've made lifestyle changes that they don't need our platform anymore. And that is truly the end goal. We are looking and working. The goal of the platform is lifestyle changes, right? And really small tweaking lifestyle changes that make a big difference over time that create a healthier outcome for you in the long run. And I would love for everybody to chuck their medication in the garbage and say, hey, thank you. It was a great, 8-month, 2-year run, whatever it was, but we're done. Appreciate the platform.
Matthew, thank you so much for joining me and explaining all of this. Keep us posted and let us know as it evolves and grows. I appreciate it.
Thank you so much, Stacey. We truly appreciate being on and truly appreciate you for everything you do. The advocacy and the voices for the diabetes community is paramount, and we love what you do, and we appreciate being on.
More information on DiabeticU over at diabetes-connections.com. The Type 2 show has its own page, and all of the episodes will stay there. And like I said, you can listen through the website or on any podcast app for the foreseeable future, even though this is our last episode of Diabetes Connections Type 2. I want the information to stay out there, so we're going to make it available for you and anybody that you think would benefit to listen to it. Thanks so much for being here. It's been amazing to be a small part of this community, and I really do hope that you continue to follow over at Diabetes Connections, where I strive to make that show really useful for people who use insulin with different types of diabetes. So please continue to let me know what you would like to hear, what information you're looking for, and join the community if you're on Facebook. Diabetes Connections, the group, is a great place to get more questions answered on the community level, not doctor level questions. I always worry about that on social media. And if you're looking for a podcast that covers type 2 issues, not just for people who use insulin, I would highly recommend TCOYD. That's Take Control of Your Diabetes. I will link up more information about them in the show notes, but they're just a great group of endocrinologists and advocates who give you great information with humor and with heart too. And they do have in-person events as well. So I always recommend TCOYD. I think they do an amazing job. It has been a pleasure to provide this information for the last year. Thank you so much for joining me. Thank you one more time to my editor, John Buchanan from Audio Editing Solutions. I'm Stacey Sims. I'll see you over on the original Diabetes Connections. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.